see my colleague, Dr. Bernardo is just logging on. Dr. Bernardo is a pediatric epilepsy neurologist here at UCSF. And he has a lot of experience taking care of children with epilepsy of all kinds. And he's going to talk to you today about wearable devices for epilepsy. So with that, I think I'll turn it over to Dan, and looking forward to your talk.
Great. Thanks, Dr. Rao. Let's see. All right, so let me try to fix this. All right, so today I'm going to be talking to you all about some of the wearable devices that have emerged in the in recent years that we use often in epilepsy, and no disclosures. So at the end of this talk, I hope that you all will be able to describe some of the new epilepsy wearables out on the market and how we can use them for management of epilepsy. And I'll also try to point out some of the limitations of these devices so that we understand how and when these are best to be used and maybe situations to avoid using these. And just the outline of my talk. So the motivation for this talk is that seizures are common and often are very difficult to control. And oftentimes our attempts to control seizures, we can run into issues like side effects from anti-seizure medicines. And just to list some of the ways that epilepsy can impact quality of life, we know that in people who have epilepsy, because of the unpredictable nature of seizures, sometimes that can lead to difficulty holding a job or difficulty taking courses at school. So it really restricts the quality of life. And there are multiple ways in that can happen. And how can wearables help address that? Before I get there, these are some of the current approaches we use to treat epilepsy. We have dietary options, numerous drugs that are available, and as well, and for patients who have seizures that really don't respond well to medicines, we can consider resective surgery or neuromodulation. And so where do epilepsy wearables fit in to this management strategy? And there are really three main areas where wearables can be of benefit. The main goal of these wearables are to enable continuous seizure monitoring at home. And by doing that, we can sometimes catch seizures that may be going uncatched. And by doing that, provide a more accurate record of when the seizures are actually happening. And if we have that accurate record, we can tailor our anti-seizure medicine or anti-drug therapies a little bit better. The other place where that's helpful is by catching seizures sooner, we can potentially treat them faster and reduce how long they last. And that can potentially avoid a trip to the emergency room or avoid a call to 911. And so that goes to maybe the main point of these wearables is that they aim to achieve accurate seizure detection, which will lead to more rapid treatment. And some of these devices have had a reported accuracy in studies of up to 98%, for example, the Embrace 2. And the way that works in theory is that after a detection of a seizure, it notifies a caregiver via an alarm, and that caregiver can then provide an acute treatment for the seizure. And that's really one of the main aims of one of these seizure alarms. The other benefit, as I mentioned earlier, is that these wearables can provide a more accurate record or log of when the seizures are actually happening. And at clinic visits, we can, as clinicians, look at that data and use it to guide anti-seizure therapy. And so just to go through some of the wearables that are out there, there are only a few that are actually FDA approved. One of the more popular ones is the Embrace Empatica, which is shown here at the bottom. And that uses a combination of biosignals, accelerometry, which is movement, photoplethysmography, which is looking at changes at the heart rate, and electrodermal activity, which is looking at changes in perspiration or sweat, basically. Another device is called the Speak, which looks at muscle activity. This is the bicep of a subject. And by detecting changes in muscle activity, this can detect seizures, primarily generalized tonic-clonic seizures, which have convulsive activity. And one thing that's in the pipeline is a device called EADDL, which is basically a single channel EEG, not unlike the EEGs that may occur in the hospital. The main difference being that it's a single channel, meaning just one of those electrodes, which can be worn at all times. And the idea there is to detect seizures on the basis of abnormal brain activity. There are other kinds of detectors out there, which I'll go through as well. There are video-based seizure detectors. Also, this isn't a wearable, it's more of an application, but we can use epilepsy applications to try and understand seizure patterns better, track medication compliance, and on the whole, try to package all of this information we're gathering into visualization, which ends up being helpful for management. And not really a wearable, but more of an invasive implant, VNS and RNS, I think are part of the big picture on how we can advance sort of tracking of seizures and provide better care through that. So dissecting some of these devices a little bit more closely, one biosignal that some of these devices looks at is movement. And so that's really one of the main modalities that the Embrace Empatica uses. The Inspire app, which is an application for the Apple Watch, these look at movements, mainly catching that rhythmic movement that may occur with a tonic-clonic seizure. Another way to measure that is through this device called the MFit, which is basically a pad that goes under the bed and can track seizure-like movements that may occur during sleep. Another biosignal that these wearables are tracking is sympathetic hyperactivity, which is basically sweating induced by a seizure. And this is just a case study where this is a patient who had a Embrace 2 watch. And the red here shows when a seizure occurred. And each of these blocks here shows a different biosignal that is being tracked. The first one is sweat activity. The second one is an accelerometer measuring movement. And we can see here, there's a lot of movement occurring when the seizure happens. And this third block here shows the respiratory rate. And we see that around the time of the seizure, there's a change in the breathing pattern. And the last block here shows changes in temperature that can be associated with a seizure. And this shows how these devices may work. So the device detects a seizure here at this red block and then sends the caregiver an alert shortly thereafter. And diving into the video-based devices, this is maybe one of the more popular video cameras that can detect seizures. It's called the SAMI. It uses motion detection to target detection of convulsive seizures. And it's trained to ignore the normal tossing and turning that may happen during sleep. The device makes a recording whenever a seizure is detected, and that is a recording that can be shared with your clinician or with other caregivers. And it also has a seizure alarm that detects the caregiver whenever a seizure is detected. And this works via an application on the iPhone or Android, which the caregiver has access to. I've also had families who found that a Nest Cam works just as well. It doesn't have some of these fancy features like the seizure alarms or the dedicated detection of convulsive activity. So it wouldn't be triggered by tossing and turning during sleep. But since these Nest Cams and other cameras have long-term video recording capabilities, that ends up being very useful as a clinician when a family brings me recordings of seizures that they captured during sleep. And so what are some of the limitations of wearables? The main limitation is a high rate of false positives that you may see. And what this graphic illustrates here is that any sort of physical activity has the potential to trigger a false alarm in a wearable. And if there are too many false alarms, it becomes a situation akin to the boy who cried wolf, where if you have too many false alarms, we encounter something called alarm fatigue, which is a tendency to ignore alarms because so many of the alarms have turned out not to be seizures. And one note here is that even the Embrace 2, which has relatively a high accuracy, has a high false alarm rate as well, as well, pretty much close to 1 false alarm per day on average for the Embrace 2. Now that's very use situation specific. Not all patients I treat will have that many false alarms, but it's certainly a concern. Another limitation is that these devices were designed for detection of generalized tonic-clonic seizures. These devices are not designed for other seizure types, for example, impaired awareness seizures or complex partial seizures. In other words, seizures where there's not a strong motor component may go undetected by this device because more subtle seizures may not have that rhythmic convulsive activity or cause a change in perspiration or heart rate, which these devices rely on to make a seizure detection. The other limitation of these devices is that they are, by design, open loop systems. And to highlight that, I'll talk a little bit about VNS, which I'm sure you all may be familiar with, is a device that is not a wearable, but it's implanted over the chest and controls seizures by sending electrical pulses to the vagus nerve. Historically, that has been an open loop system, meaning it couldn't detect seizures and respond accordingly. However, more recent versions of the VNS are closed loop systems, meaning they can track heart rate and detect changes in heart rate that may indicate an ongoing seizure and thereby adjust the treatment that's being delivered. And just to illustrate that, this is just an example of the VNS detecting a seizure and changing its therapy accordingly. And so this is a busy slide, but I'll explain. This is an EEG of a subject who has a VNS implanted. And what the first line is showing is the onset of the seizure, which is based on the EEG. And at the onset of the seizure, there's a change in the heart rate, which is this tracing at the very bottom. The VNS detects that heart rate, which is this dotted purple line, and provides more stimulation to stop the seizure. And we see here is that this rhythmic activity on the EEG, which is the seizure, has stopped after the VNS has been activated by the detection of heart rate. So this is an example of a closed loop system where detection of a change indicative of a seizure leads the device to try and treat the seizure. And that is something that these wearables are not capable of at the moment, where they are open loop systems where after a seizure has happened, they can trigger a seizure alarm, and that next step, which is treatment, really requires the participation of a caregiver to confirm that there's actually a seizure happening and it's not a false alarm, and depends on that caregiver to provide an acute treatment, which in this case, this is a nasolam or an intranasal seizure rescue medicine being given. In contrast, closed loop systems, VNS and NeuroPace, RNS, don't require the active participation of a caregiver to deliver their treatment. And this is a separate sort of subject, but not really a wearable, but epilepsy applications are related, and they have potential to improve clinical diagnosis. So this is an example here of a seizure diary that I may see in clinic, where each month is shown and every day of each month is shown, and the subject has tracked every seizure. While this is very useful information, it's hard to visually see the patterns that may be there. It's hard to sort of wade through all of that information to try to tailor therapy based on this record. Now, with some of these epilepsy applications that are available, we get maybe a better visualization of the data and are able to understand potential trends in that data and guide our treatment accordingly. And so this is an example of an epilepsy application called EPSI. This application is available on an iPhone or Android. And with this application, patients are able to log when they've given a medicine, when a seizure occurred, any stressors or potential triggers like infection that may have happened before a seizure. And after logging all that information, this is sort of the readout that the application gives, where here, for example, on the left side, it'll say that 70% of the time the medications were given on time. Sometimes the medications were given too late. And on a weekly basis, on average, this is how many seizures were happening per day, how many auras were happening per day. And we can also get a graphical format, which is shown on the right here. And sometimes we can find very helpful patterns like seizure clustering, a tendency of seizures to occur at a certain time of the month, which becomes very valuable to target our drug therapies towards. And here are some of the limitations of, another limitation of these devices is potentially costs. And these are some of the costs of some of these devices that are available. And as you can see, it's not cheap, where some of these cost a few $100s to obtain. And we have been able to get insurance authorization sometimes for the Embrace 2. However, it still ends up not being cheap to do sometimes, especially if insurance doesn't cover it. And so that's definitely an obstacle for some of these devices. And so just to conclude, this is kind of the current state of care, where without any wearables, this is what we've used historically, which is fine, but can we improve upon this model to try to achieve better management of epilepsy? The use of wearables, which enable seizure detection, medication tracking, as well as seizure video monitoring, improves overall our data gathering capabilities. And that can lead to better targeted treatments, as well as involvement of the patients we treat, where by helping us with this process, it empowers them to gain control over their seizures. So just to summarize, epilepsy wearables have the potential to improve diagnostics and treatment in epilepsy. The main limitation that I've covered is the high false positive rate, and VNS updates have turned it into a closed loop system that allow more responsive treatment of seizures. And that highlights the limitation of current wearables, where it really requires the participation of a caregiver to deliver that acute treatment or to confirm that a seizure has actually happened. And so with that, I'll ask if anyone has any questions.